Hey fam, in this video I thought we would talk about what am I talking about?
Something about dangers?
Dangers. Oh yeah, that's right. Well, I should probably restart the intro, don't you think? You think people care? Probably not. What's up fam? In this video we're going to talk about the dangers or the safety of working in mental health in a psychiatric field. My name's Nick. I'm a nurse and I wanted to share with you because I'm sure some of you out there are nurses and you might be thinking of like, hey, should I go into mental health? Should I go into psychiatry and how safe is it? And I think safety for a lot of us is probably our primary concern, and we want to feel safe when we go to work. So I wanted to share with you my perception on safety as working as a nurse inside mental health. And there's one thing that I've recently realized, and that is mental health nursing is actually pretty damn dangerous. And I didn't really realize that until I started working outside of mental health. And I feel like the epiphany came to me because, like other things in life, like your own culture, right? It's only when you step outside of your culture and you're like, oh, damn. You're like, damn, my culture's kind of weird. I didn't realize we do it this way, they do it this way. And I'm starting to see like some of the flaws of our cultures or maybe some of the benefits of our culture, things like that, right? And so that same thing happened to me with mental health as I've been working in corrections, which I know some of you might think is kind of weird. Like, what, corrections is actually safer than mental health? And I would say like 1,000 times. All right, that's a little bit exaggerated, but it's probably 10 times safer, maybe even more, working in corrections than it is in mental health. And it's only after I've worked in corrections that I'm like, holy sweet mother of God, mental health is actually a very dangerous field. And it doesn't necessarily have to be. And it really depends on the unit. Like if you work on a unit where patients are stabilized, they take their meds on a regular basis, those kind of long-term chronic units, if you will, are relatively safe. In fact, I can't even think of one time in all the years that I've worked, like 6 or 7 years in mental health, when I ever felt in danger working on one of those stabilized units. When it gets dangerous is if you're ever on a unit, and sometimes there's kind of like mixed units where it's like quasi-stable but quasi-acute, and those units or an admission unit can be extraordinarily dangerous, especially if you work admissions, because you've got a number of patients who are coming into the same physical location and they're not stable, right? So you've got patients with severe schizophrenia, severe mood disorders, bipolar mania, whatever, and they're all kind of bounce around with each other. Those kind of units can be very unpredictable and very dangerous. And then especially if you're having to give involuntary medications against patients' will, that's something we do in mental health, right? You may not know about that. Maybe you do, but just in case you don't, in mental health, if you're working on an admission unit and you're working under a psychiatrist, you more than likely will be giving involuntary medication that a judge has approved under the expertise of the psychiatrist. And so you will be giving that medication to a patient against their will, even if they don't want it. So you can imagine potentially how dangerous that gets. Imagine you have a patient who is, say, very manic, and here you are to give them their oral medication and they don't want to take it, and now they need an injection. You can see how that could just elevate things, right? So I guess I didn't really realize it until after working in corrections, but like, you know, we would go down on admission units and maybe you have a partner walking with you, but it's just you and that other person. And let's say you're working forensics. All of those patients there have some sort of what was I about to say? All those patients there have some sort of legal charge. It could be homicide. It could be robbery. It could be assault, whatever. It could be something very dangerous, or it could be something seemingly innocuous like trespassing. You don't necessarily know. And if you're on the float pool and you've never been to that unit before, you may not know any of those patients. You may not know the staff there, and that can be actually very anxiety provoking and dangerous as well. Not necessarily the staff, I'm saying just not knowing who works in the unit, the different kind of personalities you're having to navigate. And then on top of that, you've got a bunch of patients in front of you that may not be the safest patients ever. So it's only after really stepping outside of psych that now looking back in it retrospectively, I'm like, sweet mother of God, dude, psych is so incredibly dangerous, especially those admission units. And I remember now, you know, when you work admissions, there's probably a few times every week when I would feel unsafe. And by unsafe, it's not like my safety was ever really compromised, but it's more of that intuitive gut feeling that you have like something bad is about to happen. You're like a little on edge. you're hyper vigilant out there. And even though everything's kind of calm, you're just like, there's that feeling I get that something unsafe might happen. And I mean, I remember there was one time, and there's many times, in fact, you'll be working on these admission units and everybody's super chill. The day hall looks great. You've got maybe, I don't know, 10 patients out in a giant day hall. It's going fine. And all of a sudden, for whatever reason, one of your patients diagnosed with schizophrenia hears a voice like, hey, bro, go over there and smack the shit out of that guy. And so he just randomly stands up unprovoked and he just starts attacking another patient. Like, that's crazy, right? But that happens. That is mental health for you. That is schizophrenia for you. And so I just want to paint a realistic portrayal of what mental health nursing can potentially look like if you're on one of these admission units. It can just be wickedly dangerous. And I think probably the most dangerous times, I think for me, have been patients diagnosed with mania and they're floridly manic to the point where they're almost like psychotic and you have to give them an involuntary medication. Man, those are like probably the most difficult patients ever. And the crazy part is eventually you can get them stabilized and then you can revisit the experience with them and all that, which is what I typically will do, like after they've been stable on their meds for a month or so. If you're able to have a conversation with them and they're able to track the conversation and they're appropriate during the conversation and all that, I'll be like, yo, Joe, do you remember? Tell me about what you remember when you first came in. And I just like to see what they remember. And sometimes, in fact, oftentimes when they're in that acute manic phase, their memory is just, they don't remember the things that they said to you. They don't remember the names that they called you. They don't remember how belligerent they were. They don't remember getting up in your face. They don't remember that they were so pissed off that spit was flying out of their mouth when they were talking to you, right? So that's the kind of crazy thing you'll see in psych. And I don't want to deter anyone from psych because it is dangerous, but I'm just saying, like, you should definitely have a realistic idea of what you're walking into before thinking about going into psych. So, stay in shape, lift weights, maybe enroll yourself in like some Brazilian jiu-jitsu or like a practical martial art or whatever you can do to help keep yourself feeling safe on the unit. But please, if you go into mental health, realize, especially in these acute units, realize what you potentially are walking into. It's very, very dangerous. I've heard lots of horror stories of people who get hurt in psych. I've only been, I would say, kind of like truly assaulted once when I was kicked in the shin by this elderly man and I really saw it coming and I was prepared for it and things like that. But I also feel like to some degree I've been a little bit lucky. I feel like you can only work in psych for so long before you have some bizarre experience that's completely outside your control where someone tries to do something bad to you. And then obviously be prepared to be called every name in the book. If you're someone who's like sensitive to name calling and psych patients, they will figure out what your triggers are. They will figure out your insecurities and they're gonna broadcast it in front of everybody. So if that's something that worries you or concerns you, psych may not be for you. But if it's something that kind of excites you and something you like to be able to tell stories about the crazy stuff you've seen at work, then by all means, mental health might be right up your alley. But I just want to make this quick video on the dangers of psych and just let you know that yes, psych I would say is probably the most dangerous. The other thing I feel like that could potentially, ER nurses, they see a lot of psych stuff, so that potentially ER nursing could be potentially dangerous, as can any nurses working in any like kind of detox facility. They get to see it as well. And so I would say like severe mental illness, uncontrolled severe mental illness, could be schizophrenia, could be mania, bipolar, whatever, mood disorders, whatever. And then people who are coming off, who are having any kind of withdrawal symptoms from any kind of substance, sweet mother of God, those are probably by far the scariest group of patients that you'll run into. And of course, we always treat them like human beings. They are human beings. They're just going through it, right? So we're always compassionate about it. And it's like I kind of have this detached compassion for them. I get it. Like withdrawals, I'm sure it can just be horrific, and as can severe mental illness. And at this point in this video, I'm rambling, so we're going to call it a day. Thank you for watching, and I hope you found this video helpful. Bye-bye.